7 supplements that can harm cancer patients, and 7 that may actually help. Most people believe that all supplements are good for health, but when it comes to cancer, the truth is far more complicated. Some supplements may actually interfere with treatment, making chemo or radiation less effective. On the other hand, the right supplements, taken under medical guidance, may support your body during recovery. Knowing the difference can literally mean the difference between helping your body heal or putting it at greater risk. In this video, we'll uncover 7 supplements to avoid and 7 that may help, backed by science and research, so you can make safe and smart choices. Let's begin with number 1 in the list of 7 supplements to avoid during cancer treatment. 1. High-dose antioxidants, vitamin E, beta-carotene. Antioxidants are often seen as protective, but in high doses, they may do more harm than good during cancer treatment. The Journal of the National Cancer Institute warns that large doses can actually protect cancer cells from the oxidative damage that chemo and radiation are supposed to cause. This means the very supplements people think are helping could actually shield the cancer. High-dose vitamin E, and beta-carotene can reduce treatment effectiveness and may even worsen outcomes. The safest way to get antioxidants is through whole foods, not large pills or powders. Fruits, vegetables, and herbs give your body the balance it needs without overwhelming it. What makes this tricky is that antioxidants are still essential for health. The problem arises when people take megadoses, believing more is better. In reality, the body only needs a certain level, and excess may interfere with treatment. Whole food sources like berries and leafy greens provide a safe balance of antioxidants that don't compromise medical care. Doctors stress the importance of timing and dosage when it comes to supplements during cancer. Always check with your oncologist before adding or continuing high-dose antioxidant supplements. 2. St. John's wort. St. John's wort is commonly used for mild depression and mood balance, but it comes with serious risks during cancer treatment. This herb interferes with liver enzymes responsible for metabolizing chemotherapy drugs. When taken, it can cause cancer drugs to break down too quickly, reducing their effectiveness. That means treatment may not work as intended, giving cancer cells a dangerous advantage. The FDA and cancer experts strongly warn patients against taking St. John's wort during treatment. It's a perfect example of how natural doesn't always mean safe. Many patients reach for herbal remedies to help with anxiety or sadness, which is understandable during such a difficult time. But using the wrong herb can undo months of medical progress. Safer alternatives exist that won't interfere with medications. Talking with your oncologist or pharmacist about mood support is always the better route. St. John's wort might look harmless on a supplement shelf, but its hidden interactions make it a real threat for cancer patients. This is one supplement that should be avoided at all costs during treatment. 3. High-dose green tea extract, EGCG capsules. Green tea itself is generally safe and even protective, but highly concentrated green tea extract in supplement form is a different story. High doses of EGCG, the active compound in green tea, have been linked to liver damage. Research also shows that green tea extract may block the effectiveness of certain cancer drugs like bortezomib, Velcade. This makes it dangerous for patients undergoing specific treatments. While sipping tea is safe, concentrated capsules carry risks the body can't handle. Many people think, if tea is good, capsules must be better. But that's not the case here. The safest approach is to stick with brewed green tea, ideally organic, consumed in moderate amounts. This way, you enjoy the antioxidants and health benefits without the risks of toxic concentrations. Supplements are not always more powerful in a good way. They can overload the liver and disrupt delicate treatment processes. Doctors recommend avoiding green tea extract pills during treatment, even if tea itself remains safe. Cancer patients should always choose natural, balanced food and drink over highly concentrated pills. A cup of tea can comfort you. A capsule can harm you. If you're finding this information helpful, please hit the like button and subscribe. We're on a mission to reach 100,000 subscribers this year, and we cannot do it without every single one of you. Your support helps us share life-saving knowledge with more people battling cancer every day. 4. Excess iron supplements. Iron is essential for life, but too much of it can become dangerous, especially during cancer treatment. Unless prescribed for anemia, taking extra iron may actually fuel tumor growth and cause oxidative stress in the body. Cancer cells can thrive in iron-rich environments, making uncontrolled supplementation risky. Doctors always recommend checking iron levels through blood tests before taking iron. The danger lies in self-prescribing iron pills without medical advice. This can make cancer cells stronger instead of weaker. What many don't realize is that iron overload doesn't just fuel cancer, it can also damage the liver and heart. The best way to manage iron levels is through diet unless your oncologist prescribes otherwise. Foods like spinach, lentils, and lean meats offer balanced iron that the body can regulate better than pills. Supplements should only be used under strict medical supervision. Too little iron causes weakness, but too much can silently feed the disease. This is why careful monitoring is so critical. 5. High-dose selenium. Selenium is another nutrient that can flip from helpful to harmful depending on the dose. In small amounts, selenium supports antioxidant defenses and immunity. But when taken in high doses, it can cause toxicity and even increase the risk of diabetes. Studies show that people who oversupplement selenium may face more harm than protection. The safest way to get selenium is through foods like Brazil nuts, fish, and seeds. These natural sources provide just the right amount without going into dangerous territory. The problem is that many supplement companies push selenium pills as cancer protectors. While trace amounts are beneficial, excessive doses can poison the body instead of protecting it. Too much selenium can cause fatigue, hair loss, and even neurological issues. Patients recovering from cancer are especially vulnerable to these effects. Natural food sources remain the safest choice. Balance, not excess, is what helps the body heal. The truth about supplements can be shocking, but staying informed gives you control over your health. Keep watching, because the second half of this video reveals the supplements that may actually support your recovery when used wisely. Aka's Kava. Kava is often marketed as a natural stress reliever, but for cancer patients, it comes with big risks. Studies link kava to severe liver damage, and this risk is even higher for those already taking liver-straining cancer medications. While it may temporarily reduce anxiety, the long-term effects can be devastating. Liver toxicity is especially dangerous during chemotherapy, where the liver is already under stress. Doctors strongly advise avoiding kava during and after treatment. The short-term calm is not worth the long-term damage. Many natural products seem safe because they've been used for centuries, but modern cancer treatments change the equation. Combining powerful drugs with risky herbs can overload vital organs. This is why medical supervision is essential when choosing supplements. Safer methods exist for stress relief, such as breathing exercises or approved therapies. Kava's risks far outweigh its potential benefits in cancer recovery. Patients should avoid it completely to protect their liver health. 7. Unregulated immune boosters. The supplement market is full of products claiming to boost immunity. But for cancer patients, many of these blends are dangerous. They often contain untested herbal mixes in megadoses that can overstimulate the immune system. In some cases, they even interact with cancer drugs, making treatments less effective or more toxic. Because they're unregulated, you can't be sure what's inside or how safe they are. This makes them one of the riskiest categories of supplements for cancer patients. Cancer treatment already puts the immune system in a delicate balance. Pushing it too hard with unregulated supplements can cause dangerous reactions. Safer, proven approaches exist to support immunity, like balanced nutrition and supervised probiotics. Always remember, just because a label says immune booster doesn't mean it's safe. In fact, it can sometimes make recovery harder. Avoid these products unless your doctor specifically approves a certain formula. Now, here are the 7 supplements that may help with supervision. 1. Vitamin D. Vitamin D plays a key role in bone health, immune function, and even cancer survival. JAMA Oncology found that patients with adequate vitamin D levels often have better treatment outcomes. Many people are deficient in vitamin D, especially those spending more time indoors during recovery. Supplementing under medical supervision can help restore healthy levels. It may also improve mood and reduce fatigue, common struggles during cancer treatment. The best source is sunlight, but supplementation ensures consistent support. What makes vitamin D special is how it supports the whole body. Strong bones, a healthy immune system, and balanced energy all matter during recovery. Doctors often check vitamin D levels with a simple blood test. If low, they may recommend safe doses tailored to each patient. Unlike high-dose antioxidants, vitamin D has clear evidence of support in cancer care. But dosage always matters, so medical supervision remains key. 2. Omega-3 fatty acids, fish oil, algal oil. Omega-3 fatty acids are known for reducing inflammation and supporting heart health, but their role in cancer care is also significant. Research in clinical nutrition shows that omega-3s may help patients maintain muscle mass and reduce cancer-related weight loss. They also ease inflammation, which is often high during treatment. Fish oil and algal oil supplements can provide these benefits safely when monitored by a doctor. These healthy fats may also support mood and brain health. This makes omega-3s a valuable tool for recovery. What makes omega-3s especially helpful is how they reduce treatment-related side effects. They support appetite, energy levels, and overall resilience. Patients often feel stronger and less fatigued when their inflammation is under control. Like all supplements, quality and dosage matter. Choosing pure, tested sources is essential. Omega-3s can be a real ally in recovery when used wisely. They represent one of the most researched and supportive supplements in cancer nutrition. 3. Probiotics, specific strains. Gut health plays a huge role in overall wellness, and probiotics can be helpful for some cancer patients. Certain strains, like Lactobacillus rhamnosus GG, have been shown to reduce diarrhea and support digestive balance during treatment. Probiotics can also help restore the microbiome after antibiotics or chemo. However, they must be chosen carefully because some patients with very low immunity should avoid them. Supervision is essential to ensure safety. When used correctly, probiotics can make digestion smoother and treatment more tolerable. The key is to select specific strains studied for safety in cancer care. Random probiotic blends may not have the same effects and can even be risky. Doctors or dietitians can recommend the safest options based on your unique needs. Improving gut health also supports immunity and nutrient absorption, which are critical in recovery. Probiotics aren't a cure, but they can make the journey less difficult. They remain one of the most promising supportive supplements. For curcumin, turmeric extract. Curcumin has strong anti-inflammatory properties and may enhance chemo or radiation while protecting normal cells. Cancer Letters highlights its anti-tumor potential in multiple studies. It's generally safe, but absorption is improved when paired with black pepper, piperine. Curcumin may reduce inflammation, fatigue, and treatment side effects. Always take it under supervision, especially during active treatment. Natural compounds can be powerful allies if used correctly. 5. Melatonin. Melatonin isn't just for sleep. It can reduce fatigue, improve sleep quality, and support immunity. Research shows it may also reduce chemotherapy side effects and improve overall well-being. Its antioxidant effects protect healthy cells. Doses should be guided by a physician. It's a simple, natural supplement that can make treatment more tolerable. 6. Zinc, moderate doses. Zinc helps with wound healing, taste recovery, and immune health. Especially for patients experiencing mouth sores or taste changes, zinc can improve quality of life. Moderate doses are safe and effective. Excess zinc can be harmful, so supervision is important. Food sources like meat, nuts, and seeds can help too. Zinc is a small supplement with big impact. 7. Medicinal mushrooms, turkey tail reishi. Mushrooms like turkey tail have PSK, which is used in Japan alongside chemo to improve survival. Studies show they enhance immune response and may reduce metastasis. They're generally safe when used as recommended. Mushrooms also have anti-inflammatory and antioxidant properties. Make sure to get products from reputable sources. Medicinal mushrooms are one of the few supplements with strong clinical support. Now you know the supplements to avoid and the ones that may support your health safely during cancer treatment. Share this video to help others avoid dangerous mistakes and make better choices. If you haven't already, like this video and subscribe to our channel for more life-saving health tips. Your support helps us reach more people and spread knowledge that could truly make a difference.